Welcome back to Can You Hear Me, a podcast about hearing, hearing loss, and everything in between. I'm joined today by Dr. Lisa Wenstrup, audiologist and Cochlear Implant Coordinator at the University of Cincinnati. Dr. Wenstrup, thank you so much for joining me today.
Thank you so much for having me and for creating this podcast and awareness for hearing loss and cochlear implants.
Of course, thank you for your kind words, and I'm glad to have you on too. So, just to start things off today, I have a question about the motivation for your work. What inspired you to pursue audiology and more specifically to specialize in cochlear implants and clinical audiology?
That's a great question. I get asked it all the time. I had a roommate in college that had hearing loss, and I was fascinated by her ability to navigate that with her hearing loss. Not that that was a disability, but just that she had additional challenges that she had to overcome. And then one of my favorite professors in undergrad was an audiologist. I always knew I wanted to work in hearing healthcare, but I wanted a good work-life balance. So audiology was perfect for me. And then cochlear implants, I was fascinated by the science and technology. I didn't want to just work with hearing aids. I knew I wanted to work with cochlear implants. And I had the opportunity to work at UC under a mentor that taught me the ropes, and I haven't left. So I've been with the program for 23 years.
That's pretty cool, and I really like how you mentioned your roommate from college because I think a lot of people I've talked to, they don't really have this kind of personal background to their career. So I think it's really interesting that you do. My next
Yeah.
question for you is, when you meet a new patient who's considering cochlear implants, what are the most important things you want them to understand before moving forward?
For me personally, it's not the science or the technology, it's expectations and the patient understanding their role in the process, right? So we know the technology works. We know that they are going to be very successful, but they do have a part in that process. So managing expectations, because some patients think it's a quick fix, but we actually have to teach the brain to hear in a different way, which takes time. And then the patient understanding what they have to do as their part in the cochlear implant process.
That was a great answer, Dr. Wenstrup, and I really like how you mentioned some of these misconceptions patients have about cochlear implants because really what I've kind of seen when I talk to people and read these papers is that one of the biggest things with cochlear implants themselves is not that the devices themselves don't succeed, but it's that people don't have the right expectations for their cochlear implants. And this kind of leads me into my next question, which you already answered a little bit, but what are some of the most common misconceptions about cochlear implants that you encounter in your clinic?
So I specifically work with adults only. So I think a lot of people have seen the YouTube videos of children hearing for the first time, right? And that's amazing and fantastic. But I work with adults who had hearing and lost it. And I think that's even more rewarding, but they know what it's like to hear. And so I think sometimes they think it's a quick fix and they're going to understand speech right away. So cochlear implants help you hear immediately when it's activated, but that clarity and understanding takes time. And so that can be a challenge. The cochlear implant, that word has a halo effect of I'm going to have a surgery and I'm going to hear normally again. And it's very important to understand that process. You know, we're replacing a sense, so it's amazing technology, but it does take time for your brain to adapt to that.
Yeah, I definitely agree. I mean, it really is something that we take for granted on a daily basis, just being able to hear. And that's really one of the biggest ways we observe our surroundings besides being able to see. So I definitely agree with you. And real quick, do you, just out of curiosity, show your patients a recording of how a cochlear implant would sound to them beforehand? You know, for the patients like single-sided deafness who are still able to hear out of one ear?
Well, single-sided deafness patients are a little different, right? So they're comparing
Hmm.
their hearing to a normal ear. There are good
Hmm.
simulations that are out there that I will reference for patients to listen to, but I can't give them exactly what it's going to sound like to them until it's activated. So I do show them how a cochlear implant works, and I have a nice graph of the cochlea, and I try to generalize how the anatomy and physiology works and what the cochlear implant is doing. And then I do encourage them to listen to the simulations. I think the biggest thing that is helpful to patients is talking to other patients who've been through the process. So if they talk to someone who's been through the process, that gives them that reassurance of I can get to this point and understanding what they need to do. But single-sided deafness is hard because you have to tell the patient, don't compare the cochlear implant to your normal ear. Focus more on how you're hearing in stereo and the localization improvements, the reduction in tinnitus. So SSD patients are counseled a little differently than bilateral hearing loss patients.
I see, yeah, and that's definitely something I've seen where, people with single-sided deafness, they kind of have an imbalance between one ear and the other because of the, cochlear implant versus normal hearing. So it really is an interesting kind of field for investigation, in my opinion. Um,
Absolutely.
yeah, and really, this kind of gets me into my next question, which is, are there any specific public health or access issues in hearing care that you think deserve more attention?
I mean, I think the candidacy criteria expansion with Medicare covering more patients who have more word understanding has really changed the game. SSD has changed the game. It's been approved for about 6 years. But I still think insurance sometimes can be a barrier because insurance companies will find the littlest thing to say, no, that this isn't approved. And then you have to do an appeal. And not that we're not willing to do that, but sometimes that takes away resources and is frustrating as a healthcare professional to have to justify why you're recommending this when it's to help the patient and improve their quality of life. So I think we can do better with creating awareness of hearing loss and cochlear implants. We're really still not penetrating the amount of people we would like to. And then I think sometimes navigating the insurance coverage is a challenge.
I've heard that one a lot where there's some statistic that I'm forgetting now, but it's that the number of people who are eligible for a cochlear implant and could benefit from a cochlear implant don't receive it. It's like a very small number of patients who really do get to receive a cochlear implant. So I definitely agree with you when you say, these things, people need to be made more aware of this. And it would help a lot if insurance companies were more willing to, you know, provide this insurance and cover cochlear implants. I
Yeah.
know, I believe it is an issue for patients with single-sided deafness more than bilateral to receive a cochlear implant. Is that correct?
That's correct. I mean, we have to really show that they've tried the other options, right? So, like a cross or bicross or a bone conduction
Hmm.
device, and then show the FDA clinical trial of it improves localization, it helps with tinnitus, it helps with hearing and noise. So, sometimes a little more legwork, but usually we're able to get it approved.
Yeah, I mean, that makes sense. But I'm glad that they have been approved now because they're really benefiting a lot of people. So,
Right,
yeah,
right.
yeah. I mean, so just pivoting more to your research, what specifically do you think your most impactful research study was? I mean, I know your work focuses specifically on cochlear implants, so I'm curious to hear what specific aspect of cochlear implants you approached.
I was fortunate to be a part of the clinical trial with Cochlear Americas for a hybrid cochlear implant. And that was pivotal in my career because it was expanding indications for patients with those ski slope hearing losses where they have good hearing in the lows and then they have difficulty hearing in the mids and highs, but their word understanding wouldn't qualify them traditionally. And so I had a patient who presented at the FDA and that indication became approved. And so all of these people were able to be a part of getting a cochlear implant. And it introduced hybrid hearing, which is electric hearing and acoustic hearing, and kind of combining that. And then surgical techniques, which improved preservation, atraumatic insertions, which, for future technology, we want to be as atraumatic as possible. So I would say that was probably the most pivotal moment in my career. I'm very interested in the potential for totally implantable cochlear implants. I hope I get to see that in my lifetime. I'm also interested in potential hair cell regeneration or drug delivery systems to change the function of the cochlea. So that's kind of my interest. I like basic science and clinical research mostly.
Yeah, I mean that was a great answer, and I really like how you've highlighted all these sorts of, different approaches people have to hearing loss, because really, even though hearing loss is just one kind of thing, there's so many different ways people have been approaching this issue, even just in research. You mentioned the, gene editing with the hair cell regeneration, and then there's just, cochlear implant programming, and you said fully implantable cochlear implants. So all of these things, and I think it's such an exciting field. And you do seem to be predicting my next question, because just to close things off today, I wanted to ask you, as someone who deals directly with cochlear implants on a daily basis, what would you say the most exciting development you're seeing in cochlear implant technology is?
Yeah, one of the manufacturers, Cochlear, came out with a new implant that actually can give real-time information about how that device is functioning in the cochlea. And I think that's good information, right? Because most of my adults have these devices for their lifespan. And so if they have some sort of change in their health or something that impacts the implant, it would be nice to have that information. I think that allows for future technology of programming strategies. I think we could get better on the sound quality for the patient. The beauty is that the brain adapts to that input. Even if it sounds terrible, it ends up becoming their new normal. But I hope that we can improve the size of the device, programming strategies and clarity, and maybe doing some stimulation or things inside the cochlea and getting real time feedback. But I think the future of cochlear implants is very exciting.
Definitely. I mean, it just feels like there's so much going on when you read all of these papers. I know I'm mentioning gene editing again, but that's just because it's one of the things I find really interesting about this topic. But besides that, even on a probably more, recent in the future scale, cochlear implant programming techniques are improving every day, and there's just newer and better devices and better software that's just improving so many lives every day. So, yeah. And Dr. Wenstrup, I just want to thank you again for your time today. I really enjoyed our discussion. I think we've covered a lot of great topics today.
Thank you for having me, and I hope this creates access and awareness for more people to pursue cochlear implants.